Well, good evening, everyone, and welcome to our meeting. It's the 15th meeting of the 145th Council of the Corporation of the City of St. Thomas. Are there any disclosures of interest from any of the members? Seeing none, and to let everyone know, we have Councillor Taylor online tonight. So, Earl, any questions? Wave a lot and let me know. We're on to minutes.
I have a motion that the minutes of the meetings held on May the 12th, 2025 be confirmed. Moved by Councillor Peters, seconded by Councillor Herbert.
Questions or comments? Seeing none, all those in favor? Any opposed? Carried.
Next order of business are deputations. We have Dr. Tran, Medical Officer of Health, with us this evening regarding the current measles outbreak in the community.
Dr. Tran, good to have you here with us tonight.
Thank you for having me here. Thank you for the opportunity for allowing me to speak. As mentioned, my name is Dr. Ninh Tran. I'm the Medical Officer of Health for Southwestern Public Health, and I'm here to provide an update on the ongoing measles outbreak in our region, our public health response, and how we can work together to protect residents and promote immunizations. So in terms of our current situation, so this is slightly updated numbers compared to what's public out there as it's up to date as of today. We have 664 cases of measles since October, but the trends and the demographics and the patterns remain the same. This is an illness that is predominantly impacting those who are not up to date to the vaccine, primarily those who have never been vaccinated against measles. And most of these cases are 18 and under, and mostly in school-age children. So this slide is just more of a breakdown of how that is looking. There's always a small percentage of cases where we're not really sure what the immunization status is. Usually that means that if they don't know they've been immunized, they probably haven't. And you can see that close to 89% for sure have never been vaccinated. And a small percentage have had vaccination. So we know that the vaccine is effective. It's 97 to 99% effective with 2 doses after the age of 1. But it does show that you will get some cases here from time to time who are vaccinated. They tend to be a bit milder, and again, the risk of acquiring measles is dramatically higher if you've never been vaccinated against measles. And 3/4 of our cases are those 18 and under. I also do want to mention that there are hospitalizations that have happened. So 42 of our cases have been hospitalized at some point or the other. That represents 6.3% of our cases. We know our cases are an underrepresentation of the true count, so the overall hospitalization rate is lower, so that's a good thing, but there are unfortunately still hospitalizations, and the average length of stay is about 3.3 days. So this is what our outbreak curve looks like. This is actually a few days late. It's as of May 15th, but you still get the picture. So the horizontal axis is basically the point in time, and then the number of cases is really how high the bars are. So we had 26 cases in 2024, and things are going well for a bit, but I think what we realized is that they just weren't being reported to us, and then we got a slew of activities starting in February 2025. Lots of activities in February and March, a little bit down in April for a bit, and then back up. And so we've had consistent amount of activity really since 2025. So in terms of what measles is, it's one of the most contagious viruses that we know of. It is a reportable disease to public health, and it's reportable because there are complications that can happen. That includes diarrhea, ear infections, pneumonia, and rarely measles can cause brain infections as well as even more rarely death. It's highly contagious. It's spread through the air so that if someone who's infected coughs or sneezes or even breathes and talks for a while, it can spread. Other thing is that the virus can last in the air up to 2 hours after that individual has left the indoor airspace, which means that indirect exposure can also lead to infection. If you're not vaccinated and you've been significantly exposed, you're very highly likely to acquire measles. That's how infectious this is. The other tricky part of it is how it presents. So the initial presentation's fairly nonspecific, as you can see: fever, cough, runny nose, some red eyes. So they can mask any symptoms of colds. The rash appears several days later, but you're infectious 4 days before the rash happens. So when you're having nonspecific cold symptoms, you can be infectious. So that's why it can be very difficult to manage. So in terms of the role of public health, so I'll give you sort of the general buckets of roles that we have, and then I'll provide some more specifics of how we've enhanced some of our activity and response in the next slide. So surveillance is really tracking the activity and patterns, which I've demonstrated with a couple of slides in terms of the cases, when they've been happening, who they're impacting, but also case management and contact tracing. So once a case becomes aware to us, we want to sort of make sure that they're okay, they're getting sort of appropriate care, but also our focus is to prevent as much as we can the spread to others. So we're ensuring that they are isolating until the 5th day of the rash, when they would be generally not infectious. But then it's a lot of sort of backtracking in terms of who has been exposed, and providing information when we can to those. Some of the times we're fortunate and we can, in a timely way, directly notify those who have been exposed through ourselves and or for partners. Other times we do require a public notification where we're not really sure how to notify those who've been exposed. So that's where we do those media releases. And we have a running tab on our webpage in terms of the public exposures. And we've also used a useful online tool that guides people in terms of what to do, in terms of it's an exposure assessment tool. So like if you've been exposed, it asks a few questions, and based on your answers, it'll give you a tailored recommendation. So depending on when you were born, what year you're born, how many doses you've had, whether you work as a healthcare worker or other high-risk settings, it'll tailor, whether or not you can sort of go about your business and just monitor for signs and symptoms, or you need to be excluded, or you need to be vaccinated in order to return to different settings. We also do other forms of communications to the public. We've done a lot of media briefings and interviews, social media, other methods of sharing as up-to-date and reliable information as we can. And this is one of the forums we're trying to inform you as a city council in terms of your certain leadership within your community. Vaccination immunizations are critical. There's a number of, for vaccines, it's both on a proactive basis, certainly better if there hasn't been an exposure, but there are rules for what's called post-exposure prophylaxis. So you can give a vaccine, within a couple of days of being exposed, and it will actually help as well. And other outbreak control measures, and that's sometimes involving excluding kids from school who have been exposed or infected, and following up with families. And we do this in a lot of collaboration with our schools, our hospitals, and our partners, and certainly, strengthening detection and other infection prevention control measures, such as clear pathways to limit the spread. Let's say, when they're in a hospital, if people call ahead, and different protocols can be taken place. So some examples of our enhanced response. we know we have a very diverse community. So Southwestern Public Health includes Oxford County, Elgin County, City St. Thomas, and we know we have many different populations and subpopulations within our different communities. So we do certainly do targeted outreach and including multi-language messaging. We want to ensure that people have, the timely, reliable information that they want, but also in a way that they prefer. So sometimes, and so that's, trying to reduce barriers as much as we can. Sometimes that involves translating to different languages. Sometimes that involves working with community groups, faith-based leaders in terms of either tailoring, sending into different mediums, so whether it's social media and newsletters, their organizations' newsletters, their radio stations. Sometimes it's delivered by us. Sometimes, it's we provide the message to others, and they deliver the message as is. So we just work with different groups in terms of, how best to deliver information to the rest of our subpopulation. The second part is really an enhanced vaccination strategy. So generally before the outbreak, the recommendation in Ontario, and it's a bit different in other provinces, is you get your first dose at the age of 1, and then you get your second dose at the age of 4 to 6 years. And so what we've done since we declared an outbreak, early in 2025, is we've enhanced that. We've also done a recommendation and had local eligibility for an additional dose at 6 to 11 months. That's always been the case. It's not a completely new recommendation, but it'll be a new recommendation for our region. So that's always been in the eligibility, and it's usually, if people are traveling to areas of concern, they can get that. But that historically, that's been not traveling within our own region. It's usually taking a plane, traveling to another country where there's measles activity. As of this year, you don't need to take a plane, fly somewhere else to be exposed to measles. We delivered that message. We got support from the province to do that, and ensuring supply, work with our healthcare provider to do that. The other part was doing an earlier dose, the second dose. Instead of waiting 4 to 6 years, which again, in a different context, it makes sense to space it out. Some provinces do the second dose at 18 months. If you space it out, it's better from a medium to long-term impact. So if you have hardly any cases and you want to really maximize long-term protection, waiting 4 to 6 years makes a lot of sense. When we have a lot of activity, it just makes more sense to just do it earlier. So we've done that. And so what you've seen is we've essentially more than doubled our vaccinations. We compared the number of vaccines we administered through our own clinics from January to April last year, 2024, compared to 2025, it was more than 150% increase. We offered additional community clinics. We've done different outreach. We even went to people's homes. We did school post-exposure clinics. We've tried to remove every possible barrier for anyone who's interested and open to getting a vaccine. We also more than doubled the doses of measles-containing vaccines to healthcare providers. This wasn't just we're just going to dump a whole bunch of vaccines on you. This is them ordering more vaccines from us because of some additional interest, either because people just completely want to be vaccinated, or the additional 6 to 11 months, or an earlier second dose. So we know that we are reaching individuals to getting additional vaccines. We're certainly working very closely with our health sector partners. I'm in fairly regular communications with primary care hospitals in terms of for them understanding the nuanced recommendations, seeing how things are with them, how to strengthen infection prevention and control practices. And then we also work with neighboring health units and our provincial colleagues on a fairly regular basis too. And that also includes, local engagement with schools, hospital partners, community partners. Is that my time up, or is that? So I think I've already mentioned this in terms of reaching priority populations of how we work with different cultural faith leaders in providing information in the way and manner they're most receptive for it. Yeah, our messages are really two-pronged. It's about vaccination, getting vaccinated, and sometimes that means, knowing whether you've been vaccinated and whether you're up to date or not, and it can be tricky. Checking your immunization records, finding the yellow card. Sometimes people have multiple yellow cards. They bring one to the family doctor, and then the next time they get vaccinated, they forget to have yellow cards, so they get a new yellow card, and keeping track of that can be hard without a registry. And the other part is just, reducing the spread further to others. So having people being more aware of signs and symptoms, especially them being exposed, and what to do. And particularly, it was a big issue earlier, and then it improved, and then it sort of ramped up again. As sort of, we just want to remind people, if they think they might have measles, please call ahead to your healthcare provider to have the protocol. So for a while, we had to remind people, and they were good at it, and then I think the message sort of got forgotten, and we've had some more healthcare exposures recently. So in terms of what you can do as leaders of your community, share our messaging throughout your networks or different opportunities. Certainly ask questions here. I mean, I would expect if you have questions, I'd rather you talk about it here, so then you can be sort of you understand, you'd be confident when you talk to others about it, and direct residents to credible information. So we have a website, www.swpublichealth.ca/measles. So we try to put as much useful information and up-to-date information about measles, including our just general information, but also like where the exposures are happening, where to access clinics, that type of thing, and just reinforcing the importance of immunization. And happy to take any questions or comments.
Council, any questions or comments for the doctor? Rose? Sorry, Councillor Gibson?
Thank you, Your Worship. Joe?
I deserve that.
Dr. Tran, thank you very much for coming in and for giving us this information. There's a lot of public out there who are not really aware of. I work at Shoppers Drug Mart. I came across a couple of people. A question, would the pharmacies, would they be giving measles shots? I never thought to ask my pharmacist that when I was there today, so I thought I'd give you a chance to answer. Thank you.
So the short answer is generally no. So pharmacies have, by legislation as well as supply, access and legislation and authority to offer and administer generally about two publicly funded immunized vaccines. That's flu, which has been around for a long time, as well as fairly recently, last couple of years, COVID. The legislation has not been updated yet to allow pharmacies to offer other. If they can administer other vaccines, but not through the public supply, so that if you happen to get a prescription and then they can do it. So that is one of those things. And there was consultation that's happened before the election, and I imagine it'll sort of continue in terms of expanded scope of pharmacies in terms of immunizations and which type of vaccines can or should be given by pharmacies, because it's different practices across Canada. That start off with same thing like common minor ailments, that type of thing.
Further questions? Seeing none, Doctor, thank you for coming and joining us today. It's great to see you again. I haven't seen you for a while, and thank you for sharing this great message, and we'll do our best to share it also.
Right. Thank you so much for the opportunity. Nice to see you, I guess, in on your home turf this time.
Yes. Next item.
Council will now resolve itself into committee of the whole to deal with the following business. First committee this evening is Strategic Direction and Development. First item relates to the AMO 2025 delegation requests. I have a motion that reports CMO 1925 relating to the AMO 2025 delegation requests be received for information, and further that the proposed delegation requests for the 2025 Association of Municipalities of Ontario Conference, as contained in report CMO 1925, be approved for submission. Moved by Councillor Clark, seconded by Councillor Kohler.
Questions or comments? Councillor Herbert?
Thank you, Worship. When I was reading through it, and I'm assuming this would be under the Ministry of Education. We've always talked about more schools in our city, and I don't see that on the agenda. High schools or public schools, so I'm sure that probably would have been part of the discussion at some time, but I didn't see it there.
In past years, we certainly have talked planning with our local school board and with the minister, but it is more their purview than ours. Ours is looking for things where we're municipally attached, like daycare centers. Councillor Baldwin-Sands.
Last year, we did also do a delegation with the Community Sport and Recreation and Tourism with the minister. I was hoping we could do a follow-up with that, and that way we can also, prior to going to AMO, take a look at the Community Sport and Recreation Infrastructure Fund to make sure there is still money still available as we still are working forward on a community center with an aquatics facility for our community. Thank you.
If I can help you with that, we have asked for that information from the minister as to what's still left in the fund. What are some of the popular uptakes, those types of things. We didn't get the answer back yet, so we have not yet put that on this list. We get that back, we'll be able to know whether it's something we should go see the minister on. Further questions or comments? And that's not to say something else, if it comes up between now and August, wouldn't also become a ministerial delegation if we can get it. We've been pretty successful in the last number of years of getting almost every delegation we've asked for. So let's hope that we keep that. Seeing none, all in favor? Any opposed? Carried.
Next item relates to the Built for Zero Canada Homelessness Reduction Innovation Fund. I have a motion that report SCSS 1225 relating to the Built for Zero Canada Homelessness Reduction Innovation Fund application be received for information. Moved by Councillor Gibson, second by Councillor Clark.
Questions or comments on the report? Councillor Herbert?
Thank you, Worship. As I was reading through it, I noticed that it said that there's 5 rounds and it's 4.5 million is available for the first round. Is every round 4.5 million or is it just 4.5 million for all 5 rounds?
Ms. Nielsen, great to see you tonight. Please help Councillor Herbert. You're not turned on. There you go.
Sorry about that. That's better. Thank you for your question. I'm unable to confirm at this time how much the amounts will be for the next 4 rounds, but we are aware that the second round will be released this summer. And of course, we're preparing for what that might mean for our community.
Go ahead.
Follow-up question. So if it's 4.5 million and it's just going to be for 1 round and there's 5 rounds, does that leave a lot of money for the to continue to build in different communities, including ours, to get that funding?
Thank you for your question, through your worship. It's hard to say that it's a lot of money when we're talking housing. As we know, it's expensive to build affordable, supportive housing. But this funding in particular excludes capital opportunities. It's strictly operating, which limits how and why we would apply for dollars to have a significant impact here in our community. At this time anyway, it's operating only.
Further questions or comments? Seeing none, all those in favor? Any opposed? Carried.
Next item relates to Community Improvement Program grants for the property at 496 Talbot Street. I have a motion that report PD 2225 relating to the Community Improvement Program grants for 496 Talbot Street be received for information. And further, the council direct that bylaw be prepared to enter into a Community Improvement Program grant agreement with 1711664 Ontario Inc. relating to CIP application 2023-131. Moved by Councillor Peters, second by Councillor Taylor.
Questions or comments on the report? Councillor Herbert?
Thank you. This was discussed, I believe, and then Lou will be able to help me on this. Was this the one we discussed that our CIP team could not approve it? We had to bring it to council. Is this the one? Maybe not. I don't know. Thank you.
Through you, Your Worship. No, this is not that property. That's a different property, and it'll probably be in our next report. It won't be an agenda today. It'll probably be in the next agenda or the agenda soon after that. Yeah.
Okay.
This relates to the renovations that were done at the Lockwood Bookstore property on
Right.
Talbot Street, which if
Great, done.
you've noticed it, it looks great.
Yeah.
Yeah.
Further questions? Seeing none, all in favor? Any opposed? Carried.
Next item relates to temporary removal of part lot control. I have a motion that report PD 2325 relating to the application by Doug Terry Limited for temporary removal of part lot control for townhouse dwellings on lots 10, 11, 13, 14, 16, and 18 on registered plan 11M 257 be received for information. And further, that the application by Doug Terry Limited relating to the passing of a bylaw for the temporary removal of part lot control for the previously mentioned dwellings be approved. Moved by Councillor Clark, seconded by Councillor Kohler.
Questions or comments? Seeing none, all those in favor? Any opposed? Carried.
Unless the members have any further items for this committee, we'll now move into community engagement and services. First item relates to road closure request for the Old Courthouse Neighborhood Street Party. I have a motion that report ES 1625 relating to the Old Courthouse Neighborhood Street Party road closure request be received for information. And further, council authorize the closure of Prince Albert Street between Metcalf Street and Isabel Street from 4 p.m. to 11:59 p.m. on Saturday, June the 14th, 2025, to allow for the Courthouse Neighborhood Street Party. Moved by Councillor Peters, second by Councillor Herbert.
Questions or comments? Seeing none, all in favor? Any opposed? Carried.
Next item relates to Health Recruitment Partnership. I have a motion that report CMO 2225 relating to the Health Recruitment Partnership for Dr. Oyibo be received for information. And further, council direct that a bylaw be prepared to enter into a health recruitment partnership agreement with Dr. Oyibo for the provision of $33,000 in health recruitment incentive funding. Moved by Councillor Baldwin Sands, seconded by Councillor Kohler.
Questions or comments? Seeing none, all those in favor? Any opposed? Carried.
Next item relates to health recruitment partnership with Dr. Ordaya. I have a motion that report CMO 2425 relating to a health recruitment partnership with Dr. Ordaya be received for information. And further, the council direct that a bylaw be prepared to enter into a health recruitment partnership agreement with Dr. Ordaya for the provision of $33,000 in health recruitment incentive funding. Moved by Councillor Baldwin Sands, seconded by Councillor Gibson.
Questions or comments on the report? Seeing none, all those in favor? Any opposed? That's carried.
Next item relates to update relating to the YMCA City Aquatic Program Partnership. I have a motion that report PRF 1725 relating to the YMCA City Aquatic Program Partnership update be received for information. Moved by Councillor Herbert, second by Councillor Gibson.
Questions on the report? Councillor Herbert?
Thank you, Worship. This is a great idea. I really supported it from the last time we put it up for vote. My question is, the Y offers 100 city spots each session. So can the same person apply for all 3 sessions, or can you do one session, or are you restricted to one, or can you do all 3?
Mr. Bray, if you could help us with that, please.
Thank you, Mayor Preston. Through you, it's my understanding they can apply for more than one session.
Yeah. Further questions? Councillor Clark?
More comment, just it's supplying us with good information as we look at building an expensive new facility, that in the fact that in the short term, the Y is meeting our needs because we have only used half the money that has been allotted. I was worried that we'd be coming back here and looking for increased amounts of money, that the program would be so oversubscribed. So it's good to see that the needs of the citizens are being met.
Great. Further questions or comments? Seeing none, all those in favor? Any opposed? Carried.
Unless the members have any further items for this committee, we'll now move into infrastructure and civic operations. First item relates to the Canada Public Transit Fund 5-year capital plan. I have a motion that report ES 1725 relating to the Canada Public Transit Fund 5-year capital plan be received for information, and further, the council support the Canada Public Transit Fund 5-year capital plan as described in report ES 1725. Moved by Councillor Kohler, seconded by Councillor Gibson.
Questions or comments on the report? Councillor Herbert?
Through the worship, I thought quite a few years ago in my first term, I stood out front of the city hall with Jeff Urick. And I think your worship, you were there, and we talked about getting these electric buses.
Yep,
I
we
see
did.
these are all gas, are they not?
Nobody yet makes an electric bus in the small size. Many communities are now using the great big electric buses. We continue to hunt through Canada for a Canadian manufacturer of our size of bus in an electric version. I asked that same question today, Jim. So I know we'd love to do it tomorrow, but if you want, we've said we don't want great big buses driving around empty. So we'd rather look and wait for, and there's a large market for it. There's a number of communities like ours that have been waiting for an electric bus. Go ahead.
Through the worship. So we're saying we would not get an electric bus for at least 5 years. This is the 5-year plan we're locking into.
Jim, if someone comes up tomorrow that's manufacturing an electric bus, or perhaps the CAMI plant converts from making electric trucks to making electric buses, we'd take it in a minute.
Thank you.
Further questions? Seeing none, all those in favor? Any opposed? Carried.
Next item relates to wind phone installation. I have a motion that report PRF 2125 relating to the wind phone installation request be received for information. Moved by Councillor Clark. Seconded by Councillor Gibson.
Questions or comments on the report? Seeing none, all those in favor? Any opposed? Carried.
Unless there are any further items from the members for this committee, we'll now move into corporate governance and administration. First item is an item of unfinished business relating to the Strong Mayor Powers update. We've put the same mover and seconder on the agenda as for the previous meeting, and that is that report CC 0925 relating to Strong Mayor Powers update be received for information.
Questions or comments, since we already had the same mover and seconder? Councillor Peters.
Thanks, Your Worship. The clerk at the last meeting, and Lisa, I'm not sure if it's Lisa or the clerk, but they were talking that you wanted to delegate some powers back.
Yeah.
So I really wanted to have the meeting with you at the meeting, and because I want to hear what you want to delegate back, and I would just also like to hear your comments, particularly on the budget side of things. We've been so proactive of having a budget in place early December, yet this is giving you, the mayor, the latitude till February the 1st to, and I would hate to think that you would exercise your powers. And so anyway, I would appreciate, and the other one, Your Worship, that I just wanted to really understand was, and I'm assuming that these may be areas where you're going to delegate authority back, but was in the area of employment matters.
Yes.
So anyway, those were the comments I had last week, and I wanted to hear from the mayor's.
Well, let me tell you, every place where we used to use this council as delegated power, we will continue to use so in my mind. I've asked for no extra powers. I've got the best council in the world, and we work really well together. I don't need to take the powers myself when we can delegate the hiring of directors or city managers, or delegate the work on budget to be collectively us or any other of the delegations that are there. It's the legislation's written in the format where I have to remove the power from the Strong Mayor's power and delegate it back to those who are currently doing it. I've found in my time as mayor, no time when where staff or council disappointed me. And so I'm going to carry on with that thought and say that's a far better way to run a city. I made a bit of a comment while I was with some other mayors over the last few days that these aren't strong mayor's powers, these are weak mayor's powers. And if you are one, you may need these powers, but if you're not one, or you don't have a great council to work with, then you're going to be in trouble. So putting it on paper isn't going to make much difference. So I thank you for your great cooperation and how well it works. Councilor Herbert.
Thank you, Worship. Well, we did have quite a discussion on it for sure, but one thing that I did mention, I'll mention again here tonight, if you want to assert your powers, you can, but under the veto authority, within 21 days of the mayor's notice, council can override the veto with a 2/3 vote. So it's not like it's in stone for you that it's going to happen. We can, as a council, override it by a 2/3 vote, according to that there.
Of course you could, but we've never had to worry about
I know, I
voting to
understand
move it,
that.
so.
So there is an
Okay.
out for council.
But I know where you live. No, I'm just kidding. Well, we gotta get below 2/3. I know I'd go after, never mind. We'll leave it that way. Thank you. Further questions or comments on strong mayor's powers? I've been consistently saying this. Many other mayors have called me and asked me, are you sure? Or that sounds great. And whether it was at Auto Mayors 2 weeks ago or some that I was away with this last week, they all seem pretty sure of the same thing. All in favor? Any opposed? Carried.
Your worship, unless there's any further items from the members under corporate governance,
Seeing none.
council will now reconvene into regular session. I have a motion that the recommendations, directions, and actions of council and committee of the whole, as recorded in the minutes of this date, be confirmed, ratified, and adopted. Moved by Councillor Clark, seconded by Councillor Kohler.
Questions or comments? Seeing none, all those in favor? Any opposed? Carried.
No reports of committees this evening. We now move into petitions and communications. First item is a request for proclamation, jumbo lighting, and bell ringing relating to fetal alcohol spectrum disorder awareness. I have a motion that Council of the City of St. Thomas proclaims September 9th, 2025 as Fetal Alcohol Spectrum Disorder Awareness Day in the City of St. Thomas, and further that the Jumbo Monument be lit in red from September 5th to 12th, 2025, and further that the bells at City Hall be rung 9 times at 9:09 a.m. on September 9th, 2025. Moved by Councillor Herbert, second by Councillor Gibson.
Questions or comments? Seeing none, all those in favor? Any opposed? Carried.
Next item is a request for proclamation flag raising. Okay, just 2. I have a motion, and this relates to National Accessibility Week. I have a motion that Council of the City of St. Thomas proclaim May 25th to May 31st, 2025 as National Accessibility Week in the City of St. Thomas, and further that the accessibility flag be flown at City Hall from May 26th to May 31st, 2025, and further that the flag raising ceremony be held at 10 a.m. on Monday, May 26th, and further that Council of the City of St. Thomas proclaim Wednesday, May 28th as Red Shirt Day in the City of St. Thomas. Moved by Councillor Gibson, second by Councillor Taylor.
Questions or comments? Seeing none, all those in favor? Any opposed? Carried.
Next item for information, application has been made to the Alcohol and Gaming Commission of Ontario by Gino's Pizza for a liquor license for the indoor and outdoor areas at Unit 55, 417 Wellington Street, which is the Elgin Center. Council can make representation to the commission regarding the application. Next item is a letter received from the Honorable Rob Flack, Minister of Municipal Affairs and Housing, regarding development-related changes to various legislation proposed in the Protect Ontario by Building Faster and Smarter Act 2025. Comments on the proposed changes may be made until June the 11th, 2025.
Councillor Kohler on that one?
Yeah, thanks, Your Worship. Is staff preparing some comments for us for the city to put in there? Because, you know, during campaigns, you heard anything from elimination of development charges to reductions of development charges, but there'd be no better way to eliminate building if we get rid of development charges, because it's a huge financial impact to the city if we can't have a reasonable. And I think that's the problem, is some municipalities have unreasonable development charges. I know St. Thomas has been pretty competitive in that. And I think we need to be able to maintain that, because if we don't, then it's a good way to bring building to a halt.
Thank you for the comments. I've already shared that same message with Minister Flack. Not officially, but I've shared it. Go ahead, City Manager.
Thank you. Through your worship to Councillor Kohler, I can confirm that our Manager of Development Services and Environmental Services are tasked with reviewing the legislation and will provide some comments.
Great. This isn't a vote on issue. Okay, next.
Your worship, that concludes the items on the agenda under petitions and communications. If there's no further items from the members, we'll move into unfinished business of council. And seeing none, we'll now move into new business of council. Your worship.
Councillor Baldwin Sands.
Not an item of new business. I was just hoping that we could give a shout out to Weatherhead and the cleanup that's been happening under the guidance by city staff. I was hoping that Mr. Bray would be able to provide some comments, or I see that Chief Gregory is also on the line.
Mr. Bray, I know we've been in spring cleanup mode all across the city, and I had a great comment from a citizen about your department, and our works department also on cleanup. So on that issue, I thought I'd get you while you got up there. On the councillor's point.
Thank you, Mayor Preston, through you to Councillor Baldwin Sands. Thank you for that. I don't think I can take credit. I believe the owners is doing the cleanup on that, but you're right. I've been by the site. It does look much better. Thank you, though.
Yeah. Great. Further new business? Seeing none.
We'll now move into bylaws. I have a motion that leave be granted to bring in the bylaws. Moved by Councillor Peters, second by Councillor Herbert.
Questions or comments? Seeing none, all in favor? Any opposed? Carried.
I have a motion by Councillor Peters, seconded by Councillor Herbert, that the bylaws be now read a first time, referred to council and committee of the whole, and read a second time.
Questions or comments? Seeing none, all those in favor? Any opposed? Carried.
First bylaw, please.
First bylaw is a bylaw to confirm the proceedings of the council meeting held on the 20th day of May, 2025.
Questions or comments? Seeing none, all in favor? Those opposed? Next bylaw, please.
Second and final bylaw is a bylaw to temporarily remove certain lands from part lot control, lots 10, 11, 13, 14, 16, and 18 on Plan 11M 257. This relates to Harvest Run Phase 3, Stage 1.
Questions or comments? Seeing none, all in favor? Opposed? Carried. I'm happy to report that the successful passing of 2 bylaws.
Thank you.
I have a motion by Councillor Peters, seconded by Councillor Herbert, that the report of council and committee of the whole on the 2 bylaws be received and adopted. The same be read a third time, engrossed, signed by the mayor and clerk, sealed and numbered.
Questions or comments? Seeing none, all those in favor? Any opposed? That's carried.
No public notice or notices of motion this evening. There is a need to move into closed session. I have a motion that this meeting be closed to deal with a proposed acquisition of land and a personal matter about an identifiable individual. Moved by Councillor Baldwin Sands, seconded by Councillor Gibson.
Okay, before I call the vote, I'll remind the folks at home we're going to go into a closed session. We do have a public session in here at 6 o'clock, so we'll return from closed session before then. But I'm going to ask council to accompany me to room 304 for our closed session tonight, so we don't have to throw anybody out who's already here. So, all those in favor? Any opposed? Carried.
Your worship, at this time, I have a motion that council rise from closed session. Moved by Councillor Baldwin Sands, seconded by Councillor Herbert.
Questions or comments? Seeing none, all in favor? Any opposed? Carried.
We have 1 item remaining in open session that relates to appointment of a St. Thomas Public Library Board member. I have a motion that council appoint Tara McCauley to the St. Thomas Public Library Board. Moved by Councillor Clark. Seconded by Councillor Herbert.
Questions or comments on the appointment? Seeing none, all those in favor? Any opposed? Carried.
Your worship, no further items for regular council. At this time, I have a motion for adjournment. Moved by Councillor Herbert. Second by Counselor Gibson.
Questions or comments on adjournment? Seeing none, all those in favor? Any opposed? Carried.